If you wouldn't mind seeing, this is Timothy. He's come in today. He's just been a bit generally unwell, short of breath over the last 2 to 3 days, and he's been struggling feeding as well. I'm Gavin, I'm one of the nurses here, so I can help you along if you wouldn't mind. He's here with his dad.
So how long do you say he's been in? Today, did he come in?
He's just come in today, but his dad says he's been fit.
I'm knackered. I've been up all night with him.
He's been unwell for a few days, but it's got a bit worse over the night, and he's come in this morning.
Good morning, sir. Hi, nice to meet you. My name's Mickey. I'm one of the doctors.
Hi, I'm Will. I'm one of the other doctors. How are you doing?
Yeah.
Can we have
the
sheet that tells you?
Your dad on you? Is that right to say?
Yeah.
So, what exactly's been going on in the last?
Just there.
Well, Annabella's home. She's my 6-year-old. She's been bad, with cough and cold and that sort of thing. And I thought we'd escaped it, but a few days ago, Tim started coughing and spluttering, and it's just got worse the last few days, And he just won't stop coughing now. Like I said, he's up all night. He's shuttered, I'm shuttered, he's not feeding properly.
Yeah.
Alright, shh. Alright, okay. He's just not happy at all,
Yeah, so this has been going on a few days, did you say? Yeah. And how often is he coughing?
Almost constantly.
Almost constantly. And what does the cough sound like?
It's just dry cough.
Dry cough.
Just like it is now,
Yeah, Barney, poor thing. Yeah. And you say he's not been feeding properly. Has he? How much would you say he's been feeding?
Well, half the time he's coughing and spluttering all over the place. So it's like he's I don't think he's off his food, but he's also coughing and spluttering, and he's just not interested in it because it's like he can't breathe and swallow at the same time.
Yeah. Have I had anything like this before?
No. He's been a fit and healthy lad,
Yeah.
Never really had any problems.
Yeah.
He's a good birth weight, and he's never really had any issues.
Yeah. Has it been, how have his nappies been?
Not as well. He's only had one today.
Only one today?
Yeah.
Okay. And what would be normal for him?
We get through loads, I'd have had to have done 2 or 3 by now.
Okay, sure. And has he had any fevers or anything like that?
It's hard to say because he's coughing and he's putting a lot of effort into stuff. So he's a bit sweaty, do you know what I mean?
Yeah. Have you heard anything like a wheeze or anything like that when he's been breathing?
Such, no.
Okay.
Yeah.
Okay. And you mentioned he was a good, healthy birth weight.
Yeah. He was about 8'2".
8'2". And were there any issues with the delivery? Or?
No. No problem. Yeah.
Mum and baby healthy.
Yeah. They've been. Everything's been alright. Yeah.
Perfect. He's had all of his vaccines and immunisations and things like that.
We're on course. Yeah, he's had his first lot.
And is everyone happy he's meeting milestones and things like that?
Yeah. It's fine. Everybody seems happy with the way he's going. Yeah.
Perfect.
All right.
And who's at home with you?
Okay. The missus is at home with me daughters. Yeah.
Okay.
Because she, like I said, she's still a bit unwell herself, so she's keeping an eye on her.
So your daughter's been unwell as well. How have you and Mum been?
I've been alright, just tired because they've both been up all night. I was just knackered.
Okay.
Yeah.
Okay.
Sure.
Is it worth getting some observations?
We've got these are these up to date jobs?
They're from when she first came. Yeah.
Alright.
Okay. So
Okay.
That's cool. It's not very clear as before.
Oh, she stopped coughing. No, he stopped coughing for now, goodness me.
Well, perhaps get some up-to-date jobs if the coughing's
Spoke too soon, didn't I?
It's worth having a listen to his chest as well. I'll do an examination. Is that alright?
Do you want me to put him over there, or
shall we pop the baby on?
Right.
We can do it in your. We'll do it in your hands.
Yeah.
Do you want to attempt to take any further obs, or happy with what we've got on?
We'll get a repeat
repeat,
that's okay.
Okay.
Thank you very much.
Alright.
Quickly.
Okay, it's just
Thank you. There's a card. I'm just going to unbutton this.
Alright. Okay. I know. Just give me a minute.
Sounds a little distressed. I'll try and get this little cuff on his arm. Take a bit of pressure.
Yeah,
I'll try and get. I'll try and get this.
Let me give you a hand.
Yeah, you just wrap that around his finger, and we'll get.
Is he nice and warm, Gavin?
He's just a bit sweaty, isn't he?
And how's the breathing at the moment?
Feels warm. Yeah.
Is it quite increased work of breathing at all?
He's been doing like that since this morning.
Yeah.
Like his chest squat.
Yeah, he's everyone's basically. Yeah. Try and get on normal, right? Yeah, can we try that?
Just give it a whirl.
He's wiggling a little bit, isn't he?
Alright. Shh. Just let them know.
There we go.
Do you have an idea what might be going on?
No, I might speak a little more about the social side of things in a second, but I thought I'd do all these animations first. Yeah.
Alright, well, I think blood pressure we're going to have to abort. Unfortunately, he's a bit wriggly.
That's okay. Let's go around. Apologies. Would we be able to get some oxygen on just to try and put those stats up a little bit, if that's okay?
Yes, how much would you like?
Well,
Alright.
I'm not sure. I think, what would you recommend? What would you normally give in a patient of this age with those stats?
Well, I can start off with 15 litres for an on rebreathe, titrate it down if needed.
I say
We can get his dad to just sort of hold it loose.
Yeah.
Instead, they won't tolerate the mass very well. So.
Is that good?
I'm just going to put the call out well away.
Okay, perfect. When we did the exam, little chap wasn't crying. Did we hear anything on the chest at all? Any wheezing?
What's his chest like at the moment?
His chest is.
Hello, simulation switchboard.
Hiya, would you be able to put me through, or would you be able to put a crash call out to the sim ward, if that's okay, please?
Yep, no problem, we'll do.
Thank you very much.
Is there anything visible in the mouth at all?
No, it's just... Alright, there's one
Yeah, I think that's sensible.
Yeah.
In terms of the other ones, did you get a blood pressure?
No, I wouldn't tolerate.
That's no problem.
A bit tachycardic then.
We're a bit tacky. We've got a crash call put out so people are coming to help.
Okay.
We'll get that on.
Yeah.
In terms of nebulizer, how much would you like of subuse?
Do you have a beer now?
I do not think so. Maybe we'll ask one.
Yeah, we'll do an option for now.
Please consultant, I've got a crash course.
Hi, nice to meet you. So we came to review Timothy. He's 3 months old, I believe he is. So he's been generally unwell for the last 3 days of sort of dry coughs fairly regularly, not feeding much, reduced feed, reduced wet nappies.
It sounds like a bronch. Can I have a little listen?
Yeah, of course.
Is this Timothy? Hi, Dad.
How are you?
Hi, sweetheart. Can we just hold that a little bit closer to his face and I'll have a little bit of a look and a listen? So unwell for about 3 days, is that right?
Yeah, he's knocking himself, so I've been
Okay,
coughing
and I can see he's working a bit harder and running nose there.
Yeah.
All right, Puppet. Let's just have a quick listen.
Okay.
Okay, yeah. So I can hear wheezes, lots of crackles, but good air entry. All right, okay. So is he otherwise fitting well?
Normally,
Yeah, and had his vaccines and things?
Yeah, he's been up to date
okay.
with those.
So, and how's feeding going at the moment?
Not much. He's like he's coughing and spluttering all the time. He can't take the feed.
Okay.
Yeah.
And wet nappies?
Not much. He's had one this morning, since early this morning.
Okay. So, it looks like he's got something called bronchiolitis,
Right.
which is a viral illness. You and I would just get a bit of a runny nose, but because he's so much smaller, it goes onto his chest and makes him struggle to breathe.
Right.
So the treatment is supportive, so oxygen as you're giving him and as he needs it. So we'll keep an eye on his oxygen saturations. Hopefully they should be coming up shortly. We could switch him just to some nasal prongs as well, so that you don't have to hold it all the time. And then support with his feeding. So what we could do is pop a little tube down his nose into his tummy,
Right.
and we can feed him that way, and that allows him to get the nutrition that he needs, but also to relax and get better.
Okay. He's going to be all right, though, yeah.
Yes, he will be coming up to us, and he'll get the support that he needs.
Right.
I noticed the cigarette behind your ear. Is that yours?
Oh, sorry. Yeah, I forgot it was there.
Do you smoke?
Yeah.
Okay, so it will make his chest worse. So babies in particular, and also older children are more at risk from secondhand smoke.
Right.
So I don't know if you've thought about quitting at all or tried in the past.
No, you've mentioned it. I'll have to. Won't I?
Yeah, it certainly is good for you, but it's also really good for him. So.
What about vapes? Are vapes all right?
So some of them do also have nicotine in. They're not great. They can help you quit, and it can be a step to helping you quit.
Right.
So if you use it like a stepping stone, then yes, by all means. We do know that it takes at least 7 tries to quit. So don't get disheartened if it takes more than once. And we know that if you use other things like nicotine replacement packages and go into support groups, that can also increase your chances of being able to quit. But that's just something for later for you to think about. For now, we're going to give him the oxygen that he needs. We'll get him up onto the ward, support his feeding, and we'll go from there. Is there any other questions that you've got for now?
No, that's all right.
No. Okay. So our stats have come back up. Heart rate's still a bit fast. We didn't have any additional temperature or anything like that.
Temperature from
feverish
patient, you can
notifications.
do another one if you'd like.
Yeah, that's okay. It was 37.9.
Okay, that's
So,
fine.
yeah.
So you do get a little bit of a low grade temperature.
Yeah.
It's not 38, so we don't need to go down the route of thinking it's sepsis or anything like that. Of course, it might present in the same way. The other thing would be an MPA. We could just send off an nasopharyngeal aspirate to confirm that it's RSV, which is the most common cause.
Yeah. Okay. No problem.
Thank you very much for your help.
That's okay. I think I understand.
Okay. Great. Yeah. Well done. Well done.